maybe you can just describe our conversation, and that'll remind me, and other people will know as well.
Yeah, yesterday during our practicum, what I processed was an event that happened like pretty early on with my sibling um, in the car, in which she was attacking my mother, and I had to like unpry my sibling's hands from my mom's hair while she was driving, and then essentially restrain her in the back of the car so that we could at least like get home safely.
Mhm.
And then
And
I
this
was
was a
having
kind of a psychotic break for your sister.
ish, like not really. I think back then people didn't really have the understanding of a lot of the mental health that she was experiencing, and she was just very she demonstrated a lot of her behaviors very young externally, given
Mhm.
the extensive trauma that she experienced at a young age.
Oh, she did.
So yeah, so a lot of people thought that she, like, they diagnosed her with bipolar, I
I
think,
see.
like pretty young.
But you're
Definitely
saying
was
a
not.
lot of it probably has to do with the trauma.
Yeah, it was very much like unresolved trauma, and there's four of us, and
Hmm.
it just, you get lost in the sauce when you have so many kids.
Yeah, yeah, yeah. So, and that's what you processed yesterday, right?
Hmm.
So what's the result of the processing?
I feel neutral. Like, it's pretty easy to talk about. I think that that wasn't through that process. I have a lot of compassion for my sibling, and they passed away a couple of years ago. Um, and so, like, even talking about it now, that's obviously something that I'm still very much grieving.
Yeah,
Um, but there's like compassion attached to that. And that specific thing that I had processed yesterday was like, that was the first time that I had realized at a very young age that this was a lot bigger than just her choosing to do something. Like, she was pretty sick, um,
yeah, yeah.
and needing help that wasn't
I
available.
just want to clarify something. I know you're getting teary now, but
Mm-hmm.
I don't interpret that teariness as suds. Is that right?
Mm-mm.
Okay.
No.
Um, so then, so that sounds like that was a successful processing session, but what
Mm-hmm.
is it that you want to process today?
Mm, I think in that regard, I still, obviously, like, this is going to be a process, but something still just feels very intertwined with her loss and me not being there. Um, and I think it dates back to a lot of that, but
So
there's like,
those tears were suds, right?
yeah,
Yeah,
like,
yeah,
it's pretty distressing to think about the amount of suffering that she's had to experience.
yeah. Okay, so it's disturbing to think of her trauma.
Hmm.
And then I think yesterday we talked about loss, right?
Hmm.
So, so this experience of your sister going off the rails
Hmm.
was an experience also of losing her as a sane person in your life.
Yeah, she, I mean, from that point on, she like developed addiction and was engaging in substance use from, I would say, about 12, 13 years old until literally the day that she died. So, um, it's just suffering for her experience in general, and partly feels compassion like for her, but the distressing part for me is, um, like, when I think about it, just like the lack of support, and thinking about the lack of support that she had feels really distressing.
Uh-huh. So you're saying, Yesterday I interpreted it as mostly loss,
Hmm.
but you're saying a lot of it is vicarious trauma.
Hmm.
It's seeing how much pain and suffering she went through.
Yeah.
And so tell me exactly, I'm going to act stupid here. Uh, what is the experience of vicarious trauma? What do you actually experience?
Um, my like relationship with her was like fairly complicated growing up. Um, I was the target for her for a lot of her external behaviors. We were abused by the same person, and I was very internal and got the help that I needed because I was seen as the child that could cope and manage, and she was not. She was just very external with it. And
So let me stop you for a moment. When you think of the abuse from this
mhm,
person, how disturbing is it, 0 to 10?
0.
Okay, so that's resolved.
Yeah, I did extensive EMDR on it with
Yeah,
my like childhood therapist. So
yeah, okay. And but keep going.
yeah,
So,
she yeah, I was just a target for her. And her and I have talked about that and processed that and worked through that. Um, and it didn't, it, the target transitioned from me to just her harming herself.
mm,
And so that came from a lot of people, I think, misunderstanding her and not
yeah,
knowing how to support her.
yeah.
And we were 11 months apart. And so a lot of our lives were very closely intertwined, where I was responsible for her
So
and
you
her
just got
safety.
teary. What just happened?
Yeah. Um, I was just responsible for her growing up. And
So let me just take a shot. So the vicarious trauma, a lot of the pain is that you didn't prevent it.
mhm,
Okay. So it's uh I failed or it's my fault.
yeah. And when you say that, the thing that that like comes up in my head pretty quickly is I live in Portland, Oregon, and she lives in Missouri. But um 2 days before she died, I was on the phone with her and we were making all these plans and something was off and I could tell. And I asked her about it. I had asked her if she like started using again. And she was like, "No, why would you ask that, you know?" And I'm like,
Well,
"Jordan, I could tell."
anytime an addict says, "Why would you ask that?" There's a problem.
Yeah, we've been doing it for years. And so I was like, "Come on now, like you don't have to like bullshit me. Like this is we can talk about it. Like I'm not going anywhere, you know, I love you." And
Yeah, yeah.
um yeah, no, the next day she overdosed and died.
Mm,
So
okay.
yeah, I
Uh,
feel responsible, like I failed.
so let me just uh, repeat something. I think I said it to your group, but maybe not. I think of loss as having two pieces. There's the traumatic part about how the loss occurred,
Hmm.
and then there's also the loss, the grieving, the emptiness. So, um, I don't know how far we'll get today, but I always start by processing the trauma.
Yeah,
And so 0 to 10, when you think of that it was your job to keep her safe and protect her, um, how disturbing is this now?
like a 9.
Yeah. And do you have an image that represents the worst part? Oh, wait a second. Sorry, I'm doing flash. So it's a 9. Okay. So now I don't know if you've had any contact with Flash or not. If you had, you've probably got a positive engaging focus. If not, you don't. Can you think
No.
of a positive engaging focus? It could be a pet, an animal. It could be uh, your own child. It could be a sibling's child. It could be a your favorite thing to do, your favorite music, your favorite place. Um, Lots of possibilities.
Mm,
And I'm just going to say, for the class's benefit, this moment right here in this process is the most important one, because if we get a really good PEF, the process works. If we don't get a good PEF, there's contamination of the disturbance with the positive in it. You can still get this fight or flight response, and it doesn't have the same magical effect. And no pressure
I
here, because if you can't come up with something, I've got it.
okay. Um, at first I was like thinking about my dog, and I'm like, nah, it doesn't really like. I love my dog, don't get me wrong, but that's not what feels like comforting for me. And then I started thinking about my dad,
Okay,
and that
so let me just interrupt. We don't care about comforting.
okay,
What we care about is engaging. Let's do your dog.
okay, great.
So uh, now that's what we're going to talk about is your dog.
Hmm.
And I want you to tap.
Okay.
And periodically, I'm going to say the word flash. And then I want you to blink your eyes 3, 4, 5 times very rapidly. Can you try that? Perfect. That's great. So, um, what's your dog's name?
Koa.
Say it again.
Koa. Koa.
Koa. She was born in a campground?
No, he is an Australian Shepherd, and one of my best friends named him, who is from Hawaii.
I see. Okay. And so Australian Shepherd, that's a big dog, right?
Yeah, he is medium sized though.
Flash. Perfect. He's a medium-sized dog and he's into herding.
Hmm.
So he herds you around, I guess.
Not me. He herds other people he doesn't like though.
Uh-huh. Flash. Okay. And so your friend named him,
Hmm.
and so what, you were all sitting around trying to think of a name, and he said, well,
Hmm.
what about Koa?
Hmm. Yeah, he had just got back from visiting his family in Hawaii,
Uh-huh.
and
Flash. Good.
yeah,
Okay. And so how did you get Koa?
I got him from uh this like bumfuck middle of nowhere place in Missouri. From
Uh-huh. Flash. And was he like advertised and you said, oh, I'll come get him?
yeah, yeah.
Uh-huh. And what kind of, where was he advertised?
I don't remember. It was somewhere on the internet, but
On the internet.
hmm.
And there's a picture.
Hmm.
And is that what made you decide, said, oh, that's my dog?
Yeah,
Flash. And so you went to get him. And was he part of litter or, okay.
yeah.
And did you have to choose which dog in the litter was going to be yours, or he just adopted you?
I chose him.
Flash. So now I want you to take a break, and I don't want you to think of any of the details of your disturbing memory. I want you to just kind of skate over the top and see if you notice any change.
Mm, I can feel it still behind my eyes, but it's not as intense.
Not as intense. Okay. And just go back to Koa. So of how many dogs in the litter?
I think there was like 5 or 6.
Uh-huh. And what made you choose Koa?
He has a divide down his face of like light brown to dark brown fur,
Oh,
and thought it was
Flash.
really I thought it was really cute.
Cute. Flash. Great. So you took him away with you.
Hmm.
And what was that like having a really young puppy?
It was interesting. I had to
Uh-huh.
bottle feed him because
Yeah.
the person that I got him from was not like taking really good care of him.
Oh,
So I took him
Flash.
home early
Yeah. Oh, I see.
and I bottle fed him, and
Uh-huh. Flash. Well, that was a bonding experience, I assume.
yeah.
Uh-huh. Flash. And did you know how to do that or you had to learn?
Mm, I don't remember at the time. I think I like taught myself and talked to other people.
Uh-huh. Flash. I had a friend who was a uh, she would foster kittens, and so she would have 2 or 3 at a time that she'd get, sometimes 4 or 5, and had to bottle feed them all, and it was quite a process.
Hmm.
Flash, cute, very cute.
Very cute.
Flash, and has Koa. How old's Koa now?
He's 13.
Oh wow! And in his 13 years, what tricks has he learned?
Mm, he
Flash.
knows how to he knows how to play dead. He knows how to turn around. He
Uh-huh.
knows how to pick up his toys and put them away.
Oh, really?
He knows how to open doors. I taught him how to
Uh-huh.
open cabinets.
Uh-huh. Flash. Something tells me that's not the best trick for you.
It's not.
Flash. So he opens doors and he opens cabinets.
I don't know why I taught him that.
Did you teach him?
I did.
Flash.
I remember being young and just wanting him to like pick up after himself. And
Yeah.
so I taught him how to like pick things up on command and put them away and where they go.
Uh-huh. Uh-huh. Wow. Flash. So again, take a break and without thinking of any of the details, see if you notice any change.
Mm, without thinking any of the details, but just kind of like thinking about how I feel and like that
Mm-hmm.
responsibility doesn't feel as intense.
Mm-hmm.
I would say it's still like a 3, a
Mm-hmm.
4.
Uh-huh. Okay. And it was a
Um,
9.
yeah, but it's not that like it doesn't feel that tied
So
to.
the connection to the emotions is getting looser.
Mhm. Yeah.
Yeah. Okay. Um, and what's although when something's really disturbing, I don't ask about the details.
Mhm.
But when something's a 3, that's when I tend to ask about the details. It's not going to get the
Yeah.
person overly activated. So what is still disturbing that makes it as much as a 3?
Mm, see, when you talk about it, I can feel like when I think about it, I can start
It's
myself feel to
increasing.
like rise to like a 5. I
Okay,
have this very clear image of my head and the way that she was like found. Um,
okay. The
yeah.
image is disturbing.
Hmm.
Yeah, okay. Now, this would be a time that I would probably switch into EMDR because the disturbing
Mm,
part now is an image. And the BLS, the eye movements seem to really crush images. And
yeah.
so I'm going to do that if I can find my wand. I did have it a moment ago. Right. So now I want you to think of that image
Okay.
and just follow the wand. And just move your eyes to their full extent. They don't look like they're moving. That's good. That's good. 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 Move them all the way, even past the edge of your screen. So the wand is just telling you what direction to move your eyes in, and it's just a blur, really. You can't actually track it. But oh, you're doing great now. And just notice what's coming up. That's right. Just notice. That's right. Good. That's great. Good. Just notice. Just notice. That's right. Good. Good. So now I want you to blank it out and take a deep breath and tell me what you're noticing now.
I feel really sad that she was like just left there without anybody.
Yeah. What about the image?
Mm, about the image specifically, I think
Yeah, that's what
that,
was disturbing you a moment
yeah,
ago.
that she's just,
So let me ask you again. Hey, since I hear the word that, I know we're not talking the same language.
mhm.
So a moment ago, thinking of the image was very disturbing to you. And now thinking of the image, is it as disturbing?
I would say it's like a 4.
Ah, so it's gone down just very little bit.
Yeah. Yeah.
And what's the most disturbing thing about the image now?
That she was just like left there alone.
So it's not the image so much, it's the
Mm-mm.
aspects of the situation.
Mhm.
Okay, so it's her being abandoned and alone.
Yeah.
And is that related to you, like you're responsible for that? Or is that just, I hate that that happened to her?
I hate that that happened to her.
Yeah, so it's compassion.
Yeah. Yeah, like a deep passion.
Yeah, yeah. So just stay with that. Blank it out and take a deep breath. And what are you noticing now?
I notice that I still feel sad and the compassion is still very present. And the thought that comes to mind is like she must have been suffering pretty intensely, and that part feels painful.
Mm. But again, we started with that it was your job to protect her.
Hmm.
Is that the part that's painful now, or is it, I feel for her, I love her,
That I feel for her. I love her.
yeah, yeah.
Yeah.
Okay, so what I described in the beginning is that we were starting with a kind of processing of trauma,
Hmm.
and it moves into loss. And if I understand you correctly, that's really what's happened. You're
Hmm.
not reacting to the trauma any longer. You're not feeling like you screwed up, like it's your responsibility.
No.
But now what's coming up is your caring and the grieving.
Yeah. And yeah. I, like I said, this has been going on for years. And so the grief has been like anticipatory grief.
Yeah,
Um, but I think it's more rooted in compassion of like,
yeah, the
God,
caring.
yeah,
Okay, so this is what I'd like you to do. I'm checking on the time. Okay. Um, can you picture her in the room with you right now?
yeah,
Good. And now I'd like you to imagine her there, and I would like you to talk to her in your mind and tell her all the things that you would like to express to her, and move your eyes. That's it. That's good. Tell her how you felt responsible for her. Tell her how painful it is to see her suffer. Tell her how you've missed her, how you think about her. You're doing great. The things that you would say to her now if she was still alive, you didn't get a chance to say. Perhaps there were thoughts that you wish it was you that had the suffering and taken the brunt of it. And just notice how she's responding to these messages. And if she is communicating through words or some other way, a response, just notice what she's communicating to you. And now just blank it out and take a deep breath. So tell me about that.
At first it was like really painful. It was really painful to like have her here. Uh, but the image that I had of her was like very healthy, very present, very not in active use, which was a very different side of her.
Sure.
Um, so I felt like I was able to have conversations with her that we've already had before, that we've already
Mm-hmm.
discussed. And so this like emotion that's coming up is like comfort. Like I feel comforted.
Mm-hmm. Feel close to her.
Yeah.
Mm-hmm. Just tell her all these things, how close you feel to her. Again, blank it out. Take a deep breath.
It's not as uncomfortable or distressing to like have her in the room, and
Mm-hmm.
the yeah, the comfort is still there, but it's just not as like it doesn't feel as like, wow, I needed this from you. It
Mm-hmm.
feels more of like this was um I don't know, there's like more acceptance around it.
Yeah. Yeah. Now, what often I observe, notice, is that as people get into the stage that you're in where you're not feeling an acute pain thinking about this loss,
Hmm.
what happens is some of the positive memories come up, and those memories don't come up when you're trying to suppress the feelings of loss.
Yeah, I like I said have been this has been a thing that my therapist and I have like worked on for quite some
Uh-huh.
time,
Yeah.
is that the addiction was intense enough that I kind of anticipated that this was going to happen. And so
Yeah.
my sister and I had done a lot of the work to repair our relationship, but then
Uh-huh.
also I have done a lot of that work on my own to just process
Yeah.
the this is probably going to end up happening. So,
Yeah. Yeah. To grieve, begin
yeah.
grieving before it happens.
Hmm.
Yeah. Yeah. So, um, 0 to 10, how disturbing is this now?
Like a one.
And what makes it as much as a one?
I think it's just the sadness of her still being gone, you know,
Yeah.
but not necessarily around like my responsibility or
Yeah.
the like I can still see the place in which she was like left and what it
Mm-hmm.
looked like,
Uh-huh.
and that in itself is not disturbing. That's
Right. You're not having that reaction that you were having.
no, no.
And it makes sense that you would feel loss,
Hmm.
part of the grieving.
Yeah.
Well, I'm not going to do an installation or body scan. Um, this is a good demonstration. Thank you. I appreciate
Yeah.
your offering this experience to other people.
Yeah. And truthfully, like being on the other end, of even using Flash, like hearing you talk about it and describe it and then getting to experience it and having you do it, the feeling or the experience that I had was just so like I felt so distant from the intensity of that and what I was feeling a lot quicker than I think I've experienced previously doing pretty extensive EMDR on like my own stuff.
Yeah,
Um,
yeah,
so it was interesting and it was yeah, I'm glad that you used it. Um, just like even in my own reflection, because I think it would have taken me a lot longer to like get through this process, knowing how
mhm,
intense that feeling was without that
right,
being
right,
present.
yeah. Well, good. Thank you. Thank you for
Yep.
sharing.